The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Sweaty and pissed, menopause makes me sweaty and pissed.
Hello, Sweaty and Pissed listeners. This is Karen Nickel, nurse practitioner in for Sweaty and Pissed, Menopause, and more. And I am here with another listener question. This one about hypothyroidism. Our listener on our Facebook page asked how we identify hypothyroidism, what some of the symptoms are, and if we could just talk more about that disease process, which I'm happy to do for you. Before we get started, I do want to remind you that we have merchandise for you now with our Sweaty and Pissed logo, and we have several things from which to choose, including socks and fanny packs and leggings and t-shirts and backpacks and totes and lots of things. I have had a listener already ask if we had compression stockings on the website, and we are working on that. We do have socks, and they're pretty cute, but we are going to work on getting some compression stockings on the website for you. So, to hypothyroidism. When someone has low thyroid levels, it causes a generalized slowing of metabolic processes. Thyroid hormone regulates metabolism of every cell in your body. So when thyroid hormone levels are low, the list of possible symptoms one can have is very long. I'm going to go through the effects that low thyroid hormone levels have on most of our symptoms of our body. Abnormalities that can develop with low thyroid include fatigue, slow movement, slow speech, cold intolerance, constipation, weight gain, delayed tendon reflexes, and a slowed heart rate. Low thyroid hormone levels can also cause changes in tissues that lead to coarse hair and skin, a puffy face, enlargement of the tongue, and hoarseness. So the enlargement of the tongue makes people feel like they have difficulty forming words, and they feel that their tongue is too big, and their words sort of get stuck in their mouth. And then the vocal hoarseness is a fairly common finding I see with low thyroid levels. These changes are often more easily recognized in young patients, but in older patients, they may be mistaken for changes caused by normal aging. So as a provider, we have to be really vigilant about discerning whether this is normal aging or we're seeing some signs of hypothyroidism. The skin changes that occur can include sweating that is decreased. A yellowish tinge may be present, while an orangish darkening of the skin can happen if low thyroid is accompanied by adrenal failure. Dry skin can happen. Hair may become coarse. Hair loss is common, and the nails may become brittle. Blood changes can also occur with low thyroid function. Patients with hypothyroidism have a decrease in red blood cell production, which leads to anemia. B12 levels can also drop due to poor nutrient absorption when someone has low thyroid levels. Effects on the heart can include high blood pressure, low heart rate, and increase in cholesterol levels due to slowed processing of cholesterol. So sometimes when we are managing thyroid replacement for people with low thyroid, if the TSH is high, meaning the thyroid levels are too low and thyroid replacement level may be too low, and we are seeing an increase in cholesterol numbers, it is worthwhile to adjust that thyroid hormone replacement level so that we can help with managing healthy cholesterol levels as well. Respiratory changes include shortness of breath on exertion, a runny nose, poor exercise tolerance. So maybe you've been able to easily sustain 45 minutes on the treadmill, and now you're fatigued after 15 or 20 minutes, and you become more short of breath when you're exercising. Sleep apnea can also occur because the tongue enlarges, and when the tongue's big in our mouth, we don't get air in as well, and we can develop sleep apnea. Gastrointestinal changes that can happen include constipation, because the gut moves more slowly. Again, our metabolism of every cell in our body is under functioning. So the gut doesn't move as quickly, and so we develop constipation. B12 deficiency can also occur because of poor nutrient absorption, as I mentioned before. We do see an increased risk for celiac disease. This is when people cannot tolerate gluten and need to remove gluten in their diet. Celiac disease is 4 times more common in patients with hypothyroidism compared to the general population. So when we're treating someone with hypothyroidism, we also need to keep something like that in mind. Are we having GI symptoms that could be caused by celiac disease or gluten intolerance? Fatty liver can occur, and when we have a fatty liver for long periods of time, it does put us at increased risk for developing cancer of the liver. So, important to treat that. Weight gain is also a problem with hypothyroidism. Typically, hypothyroidism won't cause morbid obesity, 100-pound weight gain, but we do see a steady weight gain when our thyroid is underfunctioning. I'm going to break for a minute, and when I come back, we'll talk about some reproductive problems we can have with hypothyroidism. So some of the reproductive problems that can occur when we have low levels of thyroid hormone in our body include heavy periods, no periods, and trouble getting pregnant. So that when someone is having difficulty getting pregnant, assessing thyroid hormone levels is a very important part of working up infertility. In men, we can see low testosterone levels, erectile dysfunction, delayed ejaculation, and changes in the shape of the sperm, which can affect fertility. We also see low libido in both men and women, so low sex drive in both men and women. Hypothyroidism can also cause problems with our nervous system. I won't get into all the problems that it can cause in children and pregnant women, but there can be many and severe neurologic problems leading to significant developmental delays in children when they have low thyroid levels that are not diagnosed. In adults, we can see cognitive impairment and dementia. Again, that slow thinking. Remember that that thyroid hormone regulates the metabolism of every cell in our body, including our brain cells. So we can get cognitive impairment. We can get dementia. We also see movement disorders. Carpal tunnel syndrome is a fairly common neurologic problem that develops with low thyroid function. So if I have a patient who is already on thyroid replacement and they are developing carpal tunnel symptoms, which is numbness of your hands at night when you sleep, weakness of hands, trying to open a jar, your hands are weak. Sometimes we'll have pain just at the wrist and hand area. Sometimes we'll have pain that radiates up to the shoulder. If I have someone who has those symptoms and they're on thyroid med, I'm always checking their levels to see if we need to raise their dose to help address the carpal tunnel symptoms. Other problems that can occur include ataxia, which is the loss of muscle control that impairs walking or picking up objects. We can also develop peripheral neuropathy, which is the numbness and burning of usually our feet and hands. Some musculoskeletal changes that occur include muscle weakness, muscle cramps, muscle pain. You can also see an elevation in a muscle enzyme blood test with low thyroid function. Joint pain and joint stiffness are fairly common also. Some metabolic changes include seeing low sodium levels in the blood. We can see increases in the kidney function blood test called creatinine. As mentioned before, we will also see an increase in cholesterol levels. And we can see increases in homocysteine levels. And homocysteine, when it's high in the blood, can increase our risk for clot formation. I think we've talked about that some related to MTHFR on previous episodes, but homocysteine levels we want to keep down, and those levels can increase with low thyroid. It also affects drug clearance. So if you have low thyroid levels, we have more difficulty clearing certain drugs. And when this happens, the drug levels remain high in the blood and can cause drug toxicity. Some drugs that are affected include blood thinners, anti-seizure meds, some psych meds, and opioids. So all of those, if they're high in your blood, levels are high in your blood, it can be very dangerous. So when we see that maybe on your blood thinner, we're not as well regulated, or the blood's getting too thin, the thyroid needs to be checked to make sure that's not part of the problem there. So as you see, it affects all of our systems. It affects all of our cells in our body. So it causes many, many potential symptoms. So I hope that helps you know what to look for, because some of them are not ones that we always think of. We typically think of constipation, weight gain, fatigue, hair loss. Those are the top 4 that people think of when they think of low thyroid. But as you see now that there are many, many symptoms we can have when the thyroid levels are too low in our body. So if you're having any of those symptoms, I hope you will make an appointment with your provider and express those symptoms to him or her and get your levels checked and make sure everything's A-okay there. Again, I want to remind you of our Sweaty and Pissed merchandise, and you can find the links to that store on our Facebook page and on our website, and which is sweatyandpissed.com, sweaty and pissed with and spelled out. And you can go check out some of our fun merchandise. And I want to thank Forrest for setting that up for us, and also thank him for producing today's show and for our theme music. And I'd like to thank again Stephen Brown for our artwork for Sweaty and Pissed, Menopause and More. And Leanne and I will see you next week, or you'll hear us next week. And I hope you are staying well and staying safe and wearing a mask. See you next week.
Sweaty and pissed, sweaty and pissed. Menopause makes me sweaty and pissed.